Hello, Jeando.
Hello, Kevin.
In the last video, you were talking about the relationship and differences between theory, principles, rules, and instructions. And we're going to continue that today. So, can you give a quick overview of what we covered and how it relates to what you want to talk about today?
Yes. Well, the best thing is to go to the definition. I have constructed the definition that shows how the concepts are related. We say sometimes circular. The definition of one implies the others. So I will start with this. So let's go and start with a very simple definition. So we have a first the principle. Because the hierarchy of thinking makes it well, the highest concept. So a principle is a general rule that people or objects follow in a reason system. Just a few consideration here. Of course, you see that it's circular because you cannot define principle without having an idea of what is a rule, because principle is a general rule. So the second thing that I want to say is that rules are followed inside a reason system. So I'm going to say this because very often many people think that the Alexander technique, or what is the main branch, which I call the modern Alexander technique, is in fact a somatic technique. So inside a somatic technique, you cannot say you're inside a reason system. You do something because you feel it's necessary. And you feel it's necessary because your somatic teacher with his hands has repeated and somatically transferred to you a certain way to associate an activity with a feeling. This is obviously not a rule. It's not a reason object, so it's just an adjustment, you would say. You're adjusted to what is habitual to you. What is interesting with rules is that the rules will allow you to escape from such conditioning. Because obviously, if the conditioning was absolutely perfect, you would not need to escape from it. But you will find that very, very often. And uh, well, all objective people, or when you are going to consider the objective evidence, you will find that, well, the somatic technique, which is the golden rule in the eyes of many, who think that, well, if they have been trained with the hands, then the only way to be trained is with the hands, you will find that they do not follow a reason system. So now that we have the idea, general idea of how I define a principles, let's go back and look at the other one, which is the rule. Well, it's easier to relate with the rule because the rule is simply a verbal statement. And that verbal statement is going to tell you two things. First, a general condition. So a rule is applicable when a certain condition is on. You don't apply a rule for nothing. For example, if there is no red lights, you're not going to try and see if the light is red or green. You don't care. It's only in certain condition when there is a crossing light, then you better check whether it's red or green. So we are, of course, dealing here in a system for prevention, where if you cross the red light, you can harm yourself, but you can also harm others. So that's a reason system. So there is a condition, and then with this condition attached to it, there is an intention or a series of intentions of action, where if this is the case, then you will, well, perform something. And in the technique that we are discussing, the Alexander technique, it's a technique for readjustment, reeducation, and coordination. So in certain conditions, you need to readjust, and we will see that these intentions of actions have to be explicited. And so they are going to be explicited by one or more verbal instructions that in the Alexander technique world, we call sometimes messages, we call them instructions, we call them orders, depending. In fact, Alexander uses all these words to define this. So now that we have an idea of what is a rule, it's quite interesting to go into the detail of the technique itself. And in order to do that, I'm going to follow the scheme I've always practiced, because of course I've been trained as a taught teacher, as a stat teacher to start with, but very quickly I went away. And I went away by reading the books, or better, translating the books, which were in English, translating them into French. And so when you start to deal with the books, you get closer to Alexander. And at the same time, you discover that you need to use reasoning in order to extract the rules. Many people say that there is nothing in the books that you cannot have in 2 minutes touch lesson. Of course, I really differ with that comment. That is more, I think, a question of heated reaction than a pure reasoning. So I'm going to show you a sentence, or just a little 2 sentences, a little paragraph that is written in the books. And from there, we are going to start and see how a rule can be constructed, and what is the connection between what we call psychophysical unity and this whole principle, rule and instruction business. So let's go first to read a sentence. That's what I'm going to do. And very quickly after that, I'm going to start analyzing what is said and what we can make of that sentence. So here we go. This is the sentence. It's from Constructive Conscious Control, the second book. Alexander considered that this second book was the most interesting, the best of all. And so this one is from the 1946 edition. It's page 128. A knowledge of the psychophysical means whereby of the use of the organism in general also prevents the undue lifting of the front part of the chest during inspiration, its undue depression during expiration, and also many other defects which are developed by an imperfectly coordinated person who attempts to learn breathing or deep breathing, etc., guided by the unreliable sensory appreciation, which is always associated with an imperfectly coordinated condition of the psychophysical mechanism. So this is the sentence. And to start analyzing it, I'm going to pass on the psychophysical means whereby, because this is best exemplified at the end when we are starting to understand the rule that is hidden in this sentence, and from the rule, really a principle of kinematics that Alexander is exposing in a very strange way. So we are going to start that certain conception. Psychophysical means whereby is a conception, is a concept that you have in your mind. It's not something that you feel or will ever feel. It's some understanding you have of a mechanism. A mechanism is made of different parts, and these different parts are moving one relatively to the other. So what he's saying is that the conception is going to help the pupil prevent the undue lifting of the part of the chest during inspiration. So I asked you to find a box. And so you have a box? Yes,
yes.
that's a box. We have a box. So let's say that the box is a box, and that the box is orientated in space. So would you show us the box and show us where would you put the front of the box?
Okay, so I'll call this the front.
That's the front. So the opposite side is the back, and the top is the top, and the bottom is the bottom. Okay. So now Alexander says that we want to prevent an undue lifting of the front part of the chest. So let's take the word chest out and replace it by the word box. And we get an undue lifting of the front part of the box. And so we can start to represent that movement. So what would be the movement that you would make with the box if you were to start and try to understand what the rule is about? What is lifting the front part of the box for you?
This.
Yes, I agree with you. So when the front part of the box is lifted, the frontal plane of the box is inclined. Is that correct?
Yes.
Yes. And it's inclined backward at the top.
Yes. Good.
So this is something. So apparently we want to prevent that movement of the box. Okay. Now, when we start to reason about the rule, everything has to be explicit. We need to understand everything, and understanding in that sense doesn't mean how to feel it, because for the moment, you're the only one to feel the box. I don't feel it, but of course, I can reason about its movement as you can. So please, could you tell me what sort of movement you were making when you were lifting the front part of the box?
It's a rotation.
Yes, it's a rotation. Yes. Now, it would be interesting to be more precise, even more precise. So I would want you to hold the box with the left hand and, in fact, place the index finger of the right hand, yes, on the very center of the frontal part of the box. Could you do that? That's it. Okay, now what we see on screen is a box, and that box has a spot that I'm going to call center of rotation. In the Delsart system, they call it the center of motion. And most people don't understand the idea of center of motion. It's much easier to use a very simple word of thinking, center of rotation, because now when you're going to unduly lift the front of the box, well, we are going to see a rotation, but now this rotation is going to be more precise, because we will see that the bottom of the back of the box, where your fingers of the left hands are going to go forward. So please, could you show us an undue lifting of the box again? That's it. Yes. And you don't even need to move the right index finger. If it's a center of rotation, it's not moving. So you will only need to move the left fingers. So the back, yes, the lower back is going forward. So back forward, and undue lifting of the upper part of the chest. So that's it. We have our demonstration. And so now let's go back to the sentence just a second so that you see the condition, because it's interesting to go back and see when is it that you should prevent. So the movement we've seen is not the correct movement. It's Alexander is presenting an incorrect movement that, well, you will prevent if you have the right psychophysical means whereby. That's what the sentence is saying. And he's saying that this should not happen during inspiration. It's prevent the undue lifting of the front part of the chest during inspiration, but also, and it's undue depression during expiration. So now we have a new problem, because now we have not defined what is a depression of the chest. Yes, so a depression of the chest is also a sinking of the collar of the sternum bone. So you must know that on your box, the sternum bone is on the upper part of the front of the chest. Could you please raise again the box? And so could you set your finger in the center of the front of the box? Everything that is above that frontal part, yes, seen when we see it from the side, of course, we will call it sternum. and undue depression. So could you now do the incorrect organization of the torso? We say the wrong poise, you will see, of the chest by, in fact, unduly lift the front part of the chest. That's it. Yes. And now a depression would mean that in expiration, during expiration, you're going down. How would you go down with the sternum now? If you are doing the same rotation in the other direction, you're going upward. You will be seen to have the sternum go upward. It's not what Alexander is talking about. Depression is going down. So you'll have to take the whole thing down. There is no other way. That's it. Yeah. So we are starting to think, okay, when we read Alexander, it's necessary to start analyzing what he says, because otherwise you may tend to, well, create psychophysical errors. Yes. When you wanted to unduly lift the front of the chest, you remember that you were going up. Yes. So if you go the other way around, you are going to go down. Yes. So no, I'm sorry. I just said it in the wrong way, because when we are unduly lifting the front of the chest, we are going back, but rotating around a point that is at the front, it means that we are going back and down. So going forward and up. Could you please present the box once again so that so could you place the finger? Let's say the center of rotation is forward and the top of the chest is above it. If you rotate the box, yes, by going forward with the back, which is the lower back, so your fingers are going to go forward. Could you please show us? And we are going to show the trajectory of the top of the box. Could you now? Yes, we can see that you are going back and down with the top of the box. Now, the opposite movement, how would you describe it for the top of the box?
Forward and up.
Yes, forward and up. And so the back would go back and the upper part of the chest would go forward and up. Yes. So now when Alexander, that's it, thank you. When Alexander is stating that sentence, we have a general rule, because there is nothing in between expiration and inspiration. You are always either breathing out or breathing in. It's just a movement that is difficult to stop for a long time. Maybe you can hold your breath, but you can't hold your breath very long. So it's interesting here. And from that sentence, we can also see that there is nothing in Alexander's mind about lifting the chest as such. Because in other parts of his books, and especially in the third one, in the use of the self, Alexander is presenting the things in a way different. He's saying that he was unduly lifting the chest. And many people have thought that Alexander was talking about, well, lifting the box as a whole, as if increasing the distance between the pelvis and the rib cage. There is nothing of the sort. Well, yes, with the box. Could you show it so that people have the difference? So one was preventing the undue lifting of the front of the chest, which is a rotation. Yes, so that we want to prevent. And we want to encourage the other rotation, which is when the upper chest is going forward and up. So let's imagine that the person is starting with an unduly lifted upper chest. Alexander has a word for that. I really like it. He says in two places in Man's Supreme Inheritance, he says the pouter pigeon chest, lifting the chest in the pouter pigeon style, which this is the pouter pigeon style. So you have a pupil that is presenting himself with a sternum that is inclined backward at the top. So now you recognize the undue lifting of the front part of the chest. And what do you want? Well, you would like that person to have the chest movements organized in a very different way. You would have the person to be able to organize the movement, well, with a center of motion that is very clear, explicitly defined. The pupil will understand the movement because the pupil understands the mechanics of it. If it's a rotation, you have to tell the pupil that the center of rotation is at the bottom of the sternum. That's what we've done. And so now, when you are going to prevent the wrong movement, well, the right movement should happen. And the right movement is to bring the upper part of the chest box, or sometimes we call it rib cage, forward and up. Forward and up until going further would bring it forward and down, because you have to understand that in this rotation you have a limit. As long as you're rotating the upper part of the box forward, but you have not reached the vertical of your right index finger, you're going forward and up. You're creating an arc, and the arc is going forward and up. Well, we know something about rotation. If the spot you're rotating is past the point of rotation, if you go too far forward, you're going to go forward and down. Could you go past the vertical of your index finger to show us what would be to have the upper part of the chest, well, forward and down? That's forward and down. Yes? So we have a very clear limit. When the sternum is set vertical, we know that we have the maximum forward and up that we can reach. That is the maximum forward and up. This means that you can lift the chest as long as you don't go back in space. If you lift the chest within the limit of the vertical of the bottom of the sternum, then, well, you're applying the rule. Okay, so this is very interesting. So now let's go to the psychophysical means whereby. Alexander has a very strange idea that he calls psychophysical unity. What he means by that is that every gesture you do with your general use of the organism, which means anything you do from the feet to the head, yes, is done according to a conception. You understand that a conception is a mental idea. You're not an animal, and if you're not an animal, you have a conception, and that conception is going to dictate how you think that the movement should be done. As you repeat that movement, that conception is going to be associated with the sort of feeling you get when you do that type of movement. And the feeling is also a mental perception of what you feel. It's not an absolute analysis of all the feeling you get. No, it's the feeling you're adjusted to. And so the means whereby can be either pre-intellectual in Alexander definitions. He called it a preconception. It means that your conception of the movement of the parts is mostly somatic. It's called embodied cognition. It's animals, for example, have only embodied cognition. And so we have a pre-intellectual idea of what the movement should be like. And very quickly, it's also a preconceived idea of what the movement should feel like. If you don't feel you're balanced, you're going to take action, and it's not going to be according to an intellectual rule, an intellectual understanding. It may well be. Let's imagine that you're standing with the pelvis too far forward. Alexander said you should be standing with the hips as far back as is possible. Well, he's not saying if the is possible is somatic or if it's another kinesthesia, if it's a reason kinesthesia. So you never know. Let's look at a person that is standing, and we see that when the person is standing with the hips too far forward. In order not to fall, the person would have a tendency to bring the upper torso backward. Bringing the upper torso backward means that the front part of the rib cage is to be unduly lifted. We are back to square one. It's not only, I said it's the rule is valid when you breathe in or you breathe out. Well, in standing, you breathe in or you breathe out. So the rule is valid for standing. It's valid for sitting also. It's valid for any sort of situation of the torso in space. So we have this tendency to have a preconceived idea. That preconceived idea can be, in fact, the result of different kind of training. You can have what we call the normal training, the normal learning that everybody has. It's when you're a kid, you learn to sit, you learn to stand. You get the habit of breathing of your parents. And so you can learn to unduly lift the chest at that moment. But it's not the only place. You can have also some teachers. You can have sports teachers. You can have yoga teachers or all sorts of teachers that are going to tell you their rules about how to use the chest. And or you can have well, Alexander technique lessons, modern Alexander technique lessons, and that brings me to this consideration of psychophysical rules. These are two different epochs. The first one is a picture from 1951. On the right, you have another picture with a fairly similar idea. There is a teacher, and the teacher is using the hands. And that is in 2005. Yes, two different teachers. Well, the one on the left is Eden, but you have to know that this is FM Alexander himself, while the teacher on the right is a stat teacher. Yes? And so now the rule we were talking about of not unduly lifting the chest is in effect here on the left. It's absolutely clear that Alexander is very, very clearly organizing the movement of the rib cage as a whole. And during the whole lesson, it is seen that he's organizing the movement of the rib cage in such a way that, as we have defined earlier, the upper front part of the chest is not directed back and down. And we see that he's looking for the limit where going further forward would go forward and down. So relatively to the habitual position where the hips are too far forward and where the upper chest is used to maintain balance. If you have too much weight forward, you need something back. And what you get is, well, the protruding belly and the hips very far forward, and you get the upper torso being very far backward. As a result, I've drawn here a purple line. That purple line, as you can see, is a line on the top of the thigh, because that's where the sternum bone is. That thigh is indicating where the sternum bone is directed. So in order to obtain that gesture, there is a psychophysical concept. There is what I mean by that is that the person has a physical feeling of what is right. Certainly, we know that this teacher has been trained with hands-on. Is now teaching in other people to use hands-on too. We know, of course, that his teaching is mostly somatic. And so, as we can see, the way the person is organizing the movements of the different parts of the torso and the rib cage is completely different from that of Alexander. There is a marked difference. And so one is respecting the rule and the other is not. This does not mean that this person has no conception. The person has a conception on how to set the parts of the organism, but I maintain that this condition is not associated with a reasoning concept of the movement of the different parts of the torso. We have still a pre-intellectual concept. It's not a pre-intellectual concept learned in the infancy. It's clearly, well, a result of the training by stat. It's no offense to say that this person has learned to lengthen the torso, but the concept of lengthening the torso is very different, because we see that the physical part of the psychophysical unity is such that on one side the torso is seen to lengthen, and on the other the torso is clearly seen to shorten. So we have here an idea of a rule in action, and that rule in action is clearly very close to a principle, because you breathe in and you breathe out, as I've said, most of the time. So most of the time, the rule is applicable. And when you place your hands on somebody, well, of course, it's absolutely obvious that you should, in fact, organize the movement of your own self in such a way as to communicate the best use to your pupil. Going further from this, it's absolutely obvious also that maybe you don't need to use your hands to teach people. Because, well, we cannot escape the fact that Alexander never used hands, never had hands on. He defined all these rules using reasoning alone, or using reasoning and his capacity to see. If you have the capacity to see and to construct mechanisms in your mind, which is that you have to represent how the mechanism is working, what is going on when a person is pulling down, what is shortening the torso, what it is we want to prevent. Well, you have to understand that when you want to prevent the torso to shorten, you have to prevent movements. You have to inhibit movements. We are not discussing here tension. We are not discussing feelings. We are not discussing impression. What impression do I get when I rotate the torso in this way? Very often, I get the same comment. When we start discussing WhisperDAR, because the comment I extracted the sentence from an explanation of WhisperDAR by F.M. Alexander, and when I start discussing WhisperDAR with my pupils or students, it's very often that I get the same reaction, the same sentence by my pupil. They say, "But when I rotate the chest like this, I can't breathe." Well, I translate immediately what they say into, "You feel you can't breathe." Well, yes, I can't breathe. Well, you feel you can't breathe is a different statement that you can't breathe. It means that what you normally consider as breathing is what you feel when you breathe with the sternum inclined very far backward and down, which means that your rib cage is not poised. So it's obvious that when you're going to start the movements of rotation around center of motion of your rib cage, obviously when you're going to start at first, it's going to feel absolutely nothing like what you call breathing. Your psychophysical definition of breathing is adjusted to what you do normally. So when you're going to change what you do normally into something absolutely inhabitual, something strange that is in fact directed by reasoning alone, well, obviously, you're not going to feel that you're breathing. You're going to feel that you are, none of my pupils ever died during a lesson. And they should have if the sentence "I can't breathe" was correct. Because if you can't breathe, the issue is always the same. You die. And I can swear, yes, really, that no one died during my lessons. So what the person felt was not a correct representation of what was happening, as it is often the case. It's quite simple. Anything, Kevin? Any question? I see you wanted to react.
I think people who may want to book a lesson with you will be pleased to know that you aren't killing any pupils, although you may kill some of their misconceptions that they have when they arrive.
Yeah, the preconception. So there is something which I call a technique. A technique is obviously something special. It's a technique comes from a Greek word called techne, which is system of construction. The word techne means system of construction. So we are not dealing with poetry. We are not dealing with what I feel best or what gives me the most satisfaction or the best impression of breathing. We are really talking about something that has rules, that has, very thought about conception of mechanisms. Now, translating these conceptions into physical action, the concrete part of it, is also very important. Because as long as you hear us talking, as long as you get this sort of intellectual idea of conception, you get only half of the deal. The whole deal, the psychophysical unity, is that you must remember that the whole psychophysical unity, which is the old preconception, are very active. They don't disappear because we discuss something. What it means is that we need a sort of training, or you would call it the technique, to translate the theory, which is the psycho idea of the correct movement. We want to prevent the undue lifting of the chest, of the front of the chest. We want to prevent the lowering or the depression of the whole system of the chest. Well, yes, this is a theory for the moment. For most people, it will take some efforts in order to experiment with the movements we are talking about, experiment with the lack of breathing, experiment with the difficult aspect of not being able to, in fact, implement straight away a wish. I wish to prevent the chest from rotating. Fine. Let's see, let's make an experiment, and I'm going to give you a stimulus. Let's, for example, stand and touch the chair with the back of the knee is one I use, because Alexander said after a Delsart procedure that you could place one leg much nearer the chair than the other. So you have to move one knee back. You have to make a one-legged stance to do that. And so this is a stimulus. So fine, we have a stimulus. We can imagine that that stimulus will not prevent you from breathing, we hope. And if it doesn't prevent you from breathing, either in or out, well, then we are faced with the rule that you should not lift the upper chest backward. And of course, you should not depress the larynx that is just above it. So we are back to make an experiment. We need to see what happens when you, with your particular training, whether you had a somatic training with the Alexander technique or a somatic training during your youth, we want to see how, well, the instructions that are necessary are going to register. This is a representation. I'm going to show you a representation. I have taken a picture from a Delsart books. It's a book that was written in 1882. That is nearly 20 years before Alexander started to teach himself. And in 1882, as you imagine, there was no color. I put the color myself. I added the color. And also I changed the head. Well, for a simple reason is that the head of the person is ridiculously small for the size of the torso. So I put a new head. But look at this. The gentleman has just responded to the stimulus to place one foot nearer the chair. Okay, if you've had lesson with the Pac MacDonald branch of the modern Alexander technique, this is no surprise to you. You know that he's asking his pupil to have one foot back, nearly under the chair. And Alexander talks about it also in Constructive Conscious Control and in Man Supreme Inheritance. There are 2 quotes about this idea of placing one foot nearer the chair before standing or sitting. And so I want to show 2 different reactions. And we see only the result. So what you see, I call a position. And so I have set on top of the image a representation of the chest box and a representation of the pelvis box. And I wanted to show that in the first image, we have Alexander, observation of incorrect physical movements. And what we see is that the rib cage is poised with the upper part of the chest lifted backward and down. And we saw that the back of the chest is forward. We have a rotation. And the simplest thing is to, when you watch a person giving a lesson or receiving a lesson or moving, well, the first thing you do is there is a bone that is unmissable. It's the sternum bone. So when you see that the sternum bone is inclined backward at the top, you know that you have an incorrect lifting of the chest, that the person is not preventing the undue lifting of the chest. Yes? And so I have readjusted the movements of the chest and pelvis, because when the chest is going to rotate backward and down at the top, forward and down at the bottom, so the back is going forward and down, you will see that the pelvis has a tendency also to follow the movement of the spine. Because what is interesting in the rib cage is that the back of the rib cage is the spine. So why is it that Alexander wants to prevent the undue lifting of the upper part of the chest? Well, it's because it's shortening the back. It's shortening the spine. The thoracic spine and the lumbar spine are going to, in fact, submit to the movement, and you will see the protruding abdomen. You will see the hollowed back. You will see the arms held too far backward. Every single symptom that Alexander has clearly, time and time again, put in writing are present. So the idea is that rules in the technique of readjustment I am proposing, rules are rules that are in fact detailing instructions of movements or order of movements or directions of movements. We want the back of the lower rib cage to go back. We want the upper part of the rib cage to go forward and up. Forward and up, and we have a limit for that. The limit is when the sternum bone is seen to be vertical. Or is seen, you will see, because there are, on the readjustment on the left, you will see something, is that the sternum bone is vertical. It's exactly the representation of what Alexander is doing with his hands. Alexander is clearly, you look at the fingers, he's clearly, in fact, organizing the rib cage so that the front of the rib cage is not lifted above the backhand. If you were to place the same hands, Alexander's hands, on the body of the senior teacher, you would find that the front end would be much higher than the back one, an undue lifting of the front of the chest. So this is applicable when you see a person standing, but there is another condition. The other condition I'm interested in is a condition when the person is leaning. When you have your leaning system, you will find that you can use exactly the same rule with just a slight difference. Is that you're going to get the vertical, You have to abandon the vertical of construction, which is the plumb line construction. You abandon that and you decide that what is up is relative to the frontal part of the torso. You are going to calculate everything according to the sternum direction. Everything that I will call upward will be up along the front of the sternum. And what is forward is 90 degrees to that line. What is backward is 90 degrees to that line. So in this condition, you see, in fact, that in order to readjust the torso of the Delsart person, I have just copied the, in fact, well, representation or organization of the different movements, so that we see that when the sternum is parallel to the back line, the first consequence is the hump. We see that the head is very far forward of the back, and it's even further forward than the sternum and all the different frontal bony parts of the torso. The head is forward and upward relative to the frontal parts of the torso, because neither is the upper chest thrown backward, unduly lifted back, and it's not depressed. Because it's possible to have the frontal parts of the torso on the same line, but it's also possible to obtain that organization of the movement with a depression. So we want this organization with a lengthening not only of the back, but also of the front. That's what I get from reading that sentence of Alexander talking about the psychophysical rule. So after that, well, there is another plane or another step in the work is to, well, start to implement the rule. And you will find that when you start to implement the rule, or when you are going to explore controlled experiments where it's possible to really explore these rules, you will see at first that your old concepts are not going to, well, die easily. They are not going to be just replaced like this by the new conception. No, no, no. You'll have to find the way to transform every single instruction into, well, a corresponding action. And this is even not the real problem. The real problem is to, in fact, transform a series of instructions of movements. Because you will find that if you do take one instruction at a time and transform it, this has nothing at all to do with the coordination of all the instruction at the same time. So there is the part where it's necessary to explain to the pupil what is the conception of the movement of the different parts of the mechanism that we are talking about. But of course, there is a stage of experiments where the person has to just experiment with these instructions and see what will happen. At first, obviously, knowing the conception that is somatic, that is an embodied cognition, the person do what feels right. The person is going to have to do what feels awfully wrong. It's not going to be that simple. We'll have always to start with the first rule. And the first rule, when you want to think about coordinated action, is delayed correction, which is inhibition of the first impulse. When you listen to an instruction, well, you want to feel the result of that instruction. It's embedded in your somatic conception. When you hear an order, well, to stop and say, no, I'm not going to react to that order. I'm going to wait until I have all the orders of the different movements of the parts of the mechanism, and then I will just perform them in the dark. Because we are not interested in what you feel when you perform these instructions, because what you feel when you perform a new series of orders is adjusted to your old coordination. So you just need to learn detachment, it sounds so simple. And it's so necessary in these days well, with the COVID and all these difficulties. It's the idea that it's possible for you to perform a gesture without feeling, without having any sort of special attention to what you feel. You don't care. You want to inhibit, stop, and wait until you see the film where you're seen coordinating the movements. And the biggest surprise is when you feel awfully wrong, where everything seems to be incorrect, seems to be extreme, and then you watch your film as if you were someone else, as if you were a third person watching somebody making a gesture, and suddenly when everything feels that wrong and you see that the gesture is starting to, in fact, correspond to the rules of movement dictated by Alexander, that's the moment when you discover that conscious guidance has nothing to do with feeling something or getting the feeling of something by someone. It's completely different. It's a short exposition, but sometimes short exposition are the best.
Okay.
Any
Super.
questions?
No, just a general comment so that to tie it all together, there are principles that are true, that are always true. And then in order to enact the principles, we create rules to use in certain situations. So if we're in a certain situation, then we do certain things. And then the orders or the verbal instructions are the words that you give to yourself to enact the rule that you've reasoned out that is best for that situation. Is that right?
Yes, that's correct. Which means that for a single rule, you will need sometimes many orders. Alexander
Right.
says up to 12. So for one rule organization of the torso, you need up to 12 instructions. And many people will think, oh dear, I will never be able to think about all these things at once. And the answer is, of course, you will not at first. That's what the training is about. The training is not really a somatic training when you learn to feel in a certain way when you do a certain thing. No, you learn to, well, you train yourself to be able to inhibit and gaining, inhibit trying to feel the result of orders, and where you train yourself to have more mental object in mind at the same time to guide concrete movement that you can see later on a video recording. So the training is absolutely necessary. It's you could do that training alone. I think that if you have the books, if you have a very good system of reading, there are reading systems to read complex books like Alexander's books. Many people say that Alexander's books are badly written. Well, they should read. They should read again. You know,
I think they are badly read.
well, they are badly read. That's exactly the case. Yes,
Right.
there is so much in these sentences. You have to. Well, it's so easy to say, well, it's badly written. They are badly read. That's correct. But if you have a good system, if you have the correct style of mind, which is let's analyze what is said. And let's also, as we've done today, I wanted to give you that example because it's very important to represent what the words are saying. When you say that the front part of a box is unduly lifted, you must understand that there is a rotation involved. Because if the front of the box is unduly lifted, it means that the back of the box is not. And if you have that sentence, we are talking of a rotation of the rib cage. How many teachers, somatic teacher of the Alexander technique, have I heard? I had, I don't know, thousand and a half lesson during my younger life. How many of them have ever told me that I should consider the rotation movement of the rib cage? None, just none. Why? Well, it's because the books are badly written. It's because, in fact, we have a golden tool that is the hands. And with their hands, teachers are, of course, helping the pupil to get a direct connection with their view. with their view of what is the technique, with their feeling. It's a very personal thing. They feel that lengthening is that, they impart it to you. Is that a technique of conscious guidance and control? Of course, it is not. There are so many things in the books about, for example, leaning. If you look at nowadays how people lean, well, I've got some, I like these pictures because for me, they are a representation of the difficulty to discuss this idea that the hands are the only way to communicate conscious guidance and control. Well, the only way not to convey conscious guidance and control, because that gentleman has been trained he has received, I don't know how many lessons. I am not blaming this person in particular or any other. I'm just saying that when I look at this, I can tell that the habit of having the upper chest, the front of the chest, the front of the rib cage unduly lifted is present in every single movement he's making when touching the pupils. So his conception of lengthening the back is not the same as the conception of Alexander. And I've taken, there was this discussion about which society is better preparing his teacher. So you have STAT, ATI, and the people of STAT, the teachers of STAT are saying that they are the best. Well, when you look at the pictures and you check whether they are preventing the lifting of the front part of the chest, well, none of them are. They are all shown putting hands on people with, well, an example of what we mean by shortening the back. There is one thing, that's for sure, is that they are not using really a conscious guidance and control technique. They are transmitting an experience, so it's different. Nonetheless, they are using sentences like "let the back lengthen and widen." So it's a sentence. Let the neck be free. That's a sentence, yes. But now, where is the concrete translation of the sentence into an action in the movement they perform? Nowhere to be seen. So saying that the hands-on is the Alexander technique, or that the Alexander technique is hands-on or can only be communicated through hands-on misses completely the point. You have to, if you have a technique, that technique has to be judged by its roots, by what the person is able to perform or not. So today we've been discussing rules and orders. Thank you.
Okay, super. Thank you, Jeando. For people watching the video, you can book a lesson with Jeando. There's links underneath. He promises not to kill you in the lessons. So check that out. You should definitely experiment with that and try a lesson with Jeando. You will enjoy it. And thank you. We'll see you in the next video. Thank you, Jeando.
Thank you, Kevin.